Welcome to Strike Stroke. My name is Dr. Mekdes. Today we'll continue our talk about ischemic stroke and cover ischemic stroke due to atherosclerotic disease. Atherosclerosis is a buildup of fat, cholesterol, calcium, and other substances in the arterial wall. This buildup of cholesterol, fat, and calcium is called plaque formation. Plaque formation is a silent disease, which means you would not know it until you become symptomatic from it. And the current thought process is that the formation of plaque within the arterial wall occurs as early as one's teenage years. So how does having atherosclerosis disease cause stroke? You could think of the arterial system as pipeline in your homes. So if there was some calcium buildup or rust buildup within the pipeline, initially you might not know it because it's not significant enough to cause obstruction to water being drained out of your home. So your sink, your tub, your toilet might work appropriately. But as that calcium or rust buildup gets bigger and bigger and bigger, causing narrowing of that pipeline, you might start to notice things are backing up or not draining appropriately. We can apply that to our arterial system. So for example, if you have plaque formation in the left middle cellular artery that is building up slowly, because we said that plaque formation is a slow process, and the person is compensating very well, the system is optimized, so the person does not feel any symptom from the slow narrowing of the artery. Two scenarios can happen: that the artery one day can just totally close off and the person could become symptomatic from it, or that they're adapting appropriately and then that one day they become sick and the system's hemodynamic changes, meaning if the person becomes critically ill, their blood pressure drops. And if you can imagine, this artery is already narrow and a small amount of blood is going through it, but it is adequate enough at the time because the system is compensated. But when there's an acute change or an abrupt change in blood pressure, and the person will become symptomatic because that amount of blood that's going past this plaque to supply this specific area is not adequate enough, and this area becomes starved and we start to have ischemia. And this is ischemic stroke due to symptomatic atherosclerosis disease. One specific pattern of stroke that occurs in a person who has atherosclerotic disease is called watershed or border zone stroke. Watershed or border zone stroke describes a stroke that affects one or more of the watershed regions, and watershed regions of the brain are located at the farthest end branches of two adjacent vascular territories. For example, adjacent between the middle cellular artery and the posterior cellular artery, or the middle cellular artery and the anterior cellular artery. Those areas are called watershed regions, and they're very sensitive to acute change in blood pressure. We see this type of stroke, watershed or borderline stroke, in someone who has carotid artery atherosclerotic disease, or we can see it on both sides of the brain in a person who had prolonged low blood pressure. In summary, we talked about ischemic stroke due to atherosclerotic disease, and we also talked about that atherosclerosis is a slow progressive disease that one day could develop symptoms when the stenosis is critical enough. And we discussed that the most classic type of stroke you would have from atherosclerotic disease involving the carotid artery are watershed strokes. Thank you for watching. I hope you found this information useful. On the next episode, we'll talk about hemorrhagic stroke. And always remember to call 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke, so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.